Hello, my name is Mercedes, and today I will be talking about the effects of anorexia nervosa in the human brain. Eating disorders make no distinction in gender, age, or socioeconomic status and affect the world population. In recent years, their numbers have increased dangerously. The standards of beauty in society, which overvalue extreme thinness, are one of the main causes. The increase in this epidemiology has caused that eating disorders are now a public health concern. I have dedicated myself to investigate a little more about how this disorder affects many more aspects in people who suffer from it, in order to raise awareness about its severity. Anorexia not only affects the physical appearance of people, it leaves significant consequences in the nervous system. Nowadays, it is considered the most lethal psychiatric disease. That is why it is so important to raise awareness about the different effects it has. So, before talking about the consequences, it is important to know its definition. Eating disorders occur when a person does not receive the caloric intake that their body requires to function according to their age, height, and lifestyle. Anorexia by itself literally means lack of appetite. However, in case of anorexia nervosa, the person who suffers from it does not lack appetite. However, they intentionally stop eating and think about what to do in order not to gain weight. According to the American Psychiatric Association, who is responsible for classifying disorders, anorexia is characterized by the limitation of food intake as well as the limitation of food consumption and also an intense fear of gaining weight. This is also included by a distorted perception of having an excessive weight. Those who suffer from this disorder are not only concerned with weight regulation, but also feel very proud of their ability to control their desire to eat. Unfortunately, anorexia does not always act alone. Usually, the presence of another disorder is observed along with it, which is known as comorbidity. Obsessive symptoms are found in 25% of those with anorexia, while 1 out of 3 persons also present depressive symptoms. Now let's talk a little bit about the numbers. Just talking about Mexico, about 20,000 cases of anorexia and bulimia are recorded every year. And listen to this, the population that is mostly affected is between the ages of 15 and 19. This has been told by the Ministry of Health. Okay, so talking about the reactions in the nervous system, which is one of our main topics, the reaction to food with people with anorexia nervosa is atypical. Many studies have shown that there is a hyper-responsive emotional and hearing network to food in those who suffer from anorexia. Also, oxytocin levels are reduced. This is a hormone that is usually related to stress, so people with anorexia suffer from higher stress. Also, there has been proven that there are bigger concentrations of leptin, which regulates appetite and weight. Now let's talk a little bit more about the consequences. This time I will focus more on presenting the consequences that go far beyond what we know as the significant weight loss. To begin with, a reduction in the volume of gray matter that persists after weight recovery has been found. There are studies by psychiatrists that indicate that patients with anorexia nervosa show alterations in gray matter. In addition to this, there has been found a reduced activation in different regions of the brain, which is observed mainly during the processing of images. This greatly explains how emotions and perception can be the cause of anorexia. It was also observed that the loss of global brain volume was more pronounced in adolescent patients than in adults. As you can see, huge weight loss is not the only consequence that this problem brings. Today I talked mainly about how it affects the brain. However, there are other consequences that are worth mentioning. It is important to know that people with anorexia experience profound weakness, and also that women, it occurs something that is called amenorrhea. This is the loss of menstruation for 3 months in a row, which can later lead to infertility problems. Also, the growth in the whole body of a thin layer of hair, known as lanugo, is observed. This is something the babies have, and it comes out as an effort of the body to keep itself warm. Finally, we can conclude that the consequences of anorexia nervosa go far beyond what is commonly spoken. Eating disorders are increasing due to the pressure to have a perfect figure. It is the job of all health experts and people to carry out different jobs and campaigns in order to reduce this problem and prevent any more deaths from happening. Although many may find it hard to believe, eating disorders are way more common than we can imagine, and it wouldn't be a surprise that someone in our circle or friends has gone through or is going through any situation like this. That is why it is so important to raise awareness in people for those who suffer from it and let them know that they are not alone and there are always options to get help and create a solution. Thank you for your attention.